All right, for this explainer, we're going to do something a little different. We're going to take a leap about 2 decades into the future to explore how technology and what we as consumers want are about to completely reshape healthcare and how we pay for it.
So let's just start with a kind of wild thought. What if your insurance company knew you were getting sick, even before you felt the first symptom? What if the whole system could actually predict your health needs? And instead of just reacting to illness, it could proactively keep you well.
But to really get a handle on where we're going, we first have to understand where we are right now. And in a country like India, the sheer scale of the healthcare challenge is, well, it's enormous. And it really sets the stage for everything to come. First, let's just zoom out for a second to get some perspective. Globally, healthcare is an $8.3 trillion industry. It's one of the fastest growing sectors on the entire planet. So the stakes here, both in terms of money and, human lives, they just couldn't be higher. Okay, let's dive in. This slide, which comes from a Niti Aayog report, really gets to the core of the problem in India. You can see the different bars showing who is covered by insurance. You've got government schemes down at the bottom and private plans up top. But see that huge chunk right in the middle, labeled the missing middle? That's who we're going to focus on. And the result of that huge coverage gap is pretty staggering. As you can see here, a massive 63% of all healthcare costs in India are paid directly out of pocket. That's not insurance, it's not the government, it's individuals and families. And that kind of burden can literally wipe out a family's savings overnight. So this massive gap in protection, well, it actually has a name. It's a huge group of people that has become the central challenge for India's entire healthcare system. They're called the missing middle. So who are these folks exactly? Well, the missing middle are basically caught between a rock and a hard place. They earn too much to get help from government-subsidized insurance, but they often don't have the kind of job or the level of income they need to go out and buy a private plan. And the number of people in this group it's just mind-boggling. We're talking about 40 crore, or 400 million people. To put that into perspective for you, that is more than the entire population of the United States. All of them left financially exposed if a major health crisis hits. So why does this huge gap even exist? Well, it's not just one thing. It's a whole mix of factors. People might not even be aware of their options. The plans are often just too expensive. And frankly, there's a real lack of trust. But a key problem is that a lot of the insurance products out there just don't fit what this group actually needs. Okay, but here's where the story starts to turn. Something massive is shifting. The pandemic was a huge wake-up call for so many of us, and it's completely changing what people expect from their healthcare and their insurance. A totally new kind of demand is bubbling up. And this slide right here, it perfectly captures that shift. We're moving away from an old model that just reacts when you get sick. It pays for the hospital bill after you have a heart attack. The new model is all about proactive wellness, where people are demanding tools like fitness apps and disease management programs to stay healthy in the first place. And a huge piece of this new demand is for what's called OPD, or outpatient coverage. Basically, people want insurance that covers the everyday health stuff, the quick visit to the doctor, the blood tests, the medicines you pick up from the pharmacy. This is the stuff that really adds up for a family and affects almost everyone. And listen, this isn't just some small trend. This quote from a Deloitte study says it all. By 2040, the majority of all healthcare spending is expected to move away from treating sickness and towards promoting well-being. Think about that. The entire economic model of healthcare is basically getting ready to flip upside down. So you've got this huge problem, the missing middle, and this massive new demand for wellness. How do you bridge that gap? Well, this is where it gets really, really exciting. A wave of new technology is coming that could be an absolute game changer, helping to solve those core problems of cost, access, and trust. And at the heart of this revolution, you've got one thing: artificial intelligence. AI is the engine that's transforming pretty much every corner of the healthcare industry, from the drug discovery lab all the way to the operating table. And we're not talking about some far-off sci-fi future. This is happening right now. AI systems trained on medical data are already helping doctors read X-rays and analyze lab work with incredible speed and accuracy. So now, think about what that means. An AI tool can work 24/7 in a rural clinic, making expert-level diagnoses cheaper and available to people hundreds of miles from a major city. It's all about making healthcare more precise, more efficient, and just more accessible. So if AI is the brilliant co-pilot helping the doctor, The next level up is what's called cognitive intelligence. You can think of this as the system that can pretty much fly the plane on its own, with the human just supervising from the control tower.
I mean, just picture this, a future where a surgeon isn't the one holding the scalpel, but is instead monitoring a hyper-precise robotic system that's performing the surgery. This kind of automation promises a future with way fewer errors and much better results. And for that missing middle, it could mean that complex surgeries become more standardized and, crucially, more affordable.
And then, finally, we get down to the most fundamental level of all, the revolution happening inside our own bodies with biotechnology and genetics. This is where medicine goes from just treating symptoms to fixing the root problem at its biological source.
I mean, this is the real holy grail of medicine, right? We're talking about using gene therapy to literally repair damaged DNA or diagnosing cancer at a molecular level long before it ever becomes a crisis. We're even talking about 3D printing a new organ when one fails. This is a shift from a system of treatment to a system of cures.
All right, so let's pull all these threads together. We've got this new consumer demand for wellness. We've got these unbelievable new technologies. What does the world of health and insurance actually look and feel like in 2042? Well, the journey pretty much looks like this. We are moving from today, where something like 80% of all spending is on reactive care and treatment, to a future where the majority of that spending is on proactive health and well-being. The whole system, powered by our smart devices and AI, will have one main goal: keeping you healthy from the very beginning.
Which brings us right back to where we started, with these incredibly powerful tools that can make healthcare so much cheaper, so much more precise, and so much more accessible. We have to ask the ultimate question: can technology finally close that gap for the 400 million people in the missing middle and deliver on that promise of quality healthcare for all?